My name is Elena Coyle, and today we're going to be talking about drugs and medications prescribed for sleep disorders. I've suffered from insomnia and other sleep disorders for most of my life, and so I've tried just about every medication there is. Some work, some don't, some are effective for a while and then stop working, and some have more serious side effects than others. It's really a trial and error process trying to find the right medication for you. So be patient and try each medication and give it some time to work, and hopefully you'll find one that works for you. There are many over-the-counter sleep aids that you can take at first to try. They have fewer side effects and the risk of dependence is not as high. So try antihistamines with diphenhydramine HCI. These over-the-counter aids are usually for mild insomnia and are to be used only for about 2 weeks. But again, they're worth a try. There are a class of sedative hypnotics to take when you are experiencing more serious insomnia. Ambien and Ambien Cr are a couple of common ones. Ambien Cr is a stronger medication. The Cr stands for controlled release, and it has 2 layers, one to help you fall asleep and one to help you stay asleep. It's a stronger medication, and so it has a bit stronger side effects. You can experience dizziness, dry mouth, headaches, diarrhea, next day grogginess, and memory loss. Ambien Cr has a unique side effect that doesn't affect everyone, but it happened to me, where you don't really know what you are doing when you take the medication. It gives you a drugged, drunken feeling, lowers your inhibitions, and makes you do things that are uncharacteristic. And the next day you may have no recollection of doing any of these things. My husband would tell me I would go for walks or write emails or make phone calls and some other things that I really didn't remember doing. So be careful when you take these medications and have someone with you so they can keep an eye on you. Lunesta and Sonata are another couple of medications that are commonly prescribed for insomnia. And again, the side effects vary from person to person, but some of the more common ones are dry mouth, diarrhea, dizziness, headache, and next day drowsiness. For me, it was the unpleasant taste in my mouth that I couldn't get rid of even hours after taking the medication that made me stop. But they can be very effective for others. All of these medications have a risk of dependence, and there's serious side effects. So take these medications only as prescribed by your doctor. And again, it's a good idea to have someone with you when you take these medications, just to make sure you don't experience any of the severe side effects. Another type of medication used commonly for insomnia are anti-anxiety drugs. Benzodiazepines like Xanax and Klonopin and Ativan are used for insomnia, especially for those who experience high levels of stress or anxiety. Many of us feel we could get a good night's sleep if we could just turn our mind off, and these medications can help with that. They can relax you and calm you down enough so you can fall asleep. They may not help you stay asleep, however. The risk of next day drowsiness is high, as well as dependence. And the withdrawal symptoms can be very challenging to deal with. You can have shakiness, nervousness, and anxious feeling. So don't use these medications longer than your doctor recommends. Antidepressants are also commonly prescribed for insomnia. Even if you aren't depressed, in low doses, these medications can be very effective. Trazadone, Doxepin, Nortriptyline. These are prescribed when you have mild to serious insomnia, and they can be very effective. I currently take Doxepin for insomnia. It has fewer side effects. It doesn't leave me feeling groggy the next day. However, the risk of developing an immunity for these medications is high. So while they may work for a while, they can stop working for you. Side effects increase with alcohol or other drugs, so use these medications only as directed by your doctor. You also want to report any unusual side effects right away. Try not to get discouraged when you are trying to find the right medication for you. It does take a lot of patience. It takes time and trial and error, so please be patient. And that's how I see it as an expert on sleep. But I encourage you to reach out to your doctor for more details, or go to Google and type in drugs and medications for sleep disorders for more information. Thanks for watching.